Hi there, Dr. Gary here on the road. We sell dental practices nationwide. We are dental practice brokers. I was a dentist for 25 years. Now we're doing the brokers for the last 16 years. Today's topic: under what circumstances should you never sell your practice under conventional means? We'll get into what I'm talking about there. So, as of now, we have 10 employees. We have 2 CPA accountants, marketing director, operations director, and we are moving forward rapidly. We are now accredited by the Academy of General Dentistry for continuing education. So our courses that we are giving, are at this point credits for all the cruises we have. We do have the new cruise coming up soon, by the way. That's in Japan, mid-April. Anyway, we're available now 363 days a year. You could reach us by calling us 201-663-0935 or dentalpracticeguide.com or nationwidedentalpracticebrokers.com. You can always reach us. We have a lot of good content in there which you might like. Now, if you have a larger, and everything you're about to hear is for entertainment purposes, not legal advice. If you have a larger practice, and you're doing close to $1 million or more, and you have 4 or 5 operatories, you're willing to stay on to work, have a decent hygiene program, you might be a candidate for a DSO sale. They'll often pay our commission. We work closely with them. We're not employed by them, but they'll often do it. And the opportunities are just fantastic. With some of the DSOs, you got to be with the right ones. It just can't be any DSO, because we're shifting more towards the larger DSOs nowadays. We think that's better for you and more long-term prosperity. Also, we can help you navigate it. Since often they'll pay our commission, it makes sense to sign up with us. And if your practices are going to sell for over $1 million, upon successful sale, we will be able to reimburse your legal fees. We've done that multiple times. If it closes for over $1 million and we're representing you, we've done this multiple times. So give us a call about that too. Based on minor criteria, like you have to have a well-qualified dental attorney and some other small criteria. Anyway, the topic today is when you should not sell your practice in a conventional means. Conventional means you sell the practice and the leasehold improvements. That is, they take over your lease, or they take over the building, they buy the real estate, or they continue to lease, but they're buying the whole package. It's the complete office with all contents, all chairs, all equipment, and so forth, and the practice itself. But one of those circumstances, it happened today, when the rent, it's a lower grossing practice, under 200, when your rent is about 30%, actually anything over 10%, you're a little worried. But if you have a rent that's 30% of your gross, it's like, what are you doing? You're not making any money there. You can't sell that practice. In the conventional means, that's a record sale. Now, hopefully, I just spoke to a doctor. They just renewed their lease at 30% of gross. I'm like, what are you doing? We can't sell this thing as is. You got to get out of the lease somehow. Perhaps you have a clause of disability or something like that. Talk to an attorney. But you can't. The practice will not sell conventionally under most circumstances. There could be a unique circumstance. No, but under most circumstances, if your rent is 30% or even higher than 10, 12% of gross, it's very challenging. Don't even think about it. Don't waste your time. Go right immediately to a record sale. Try to get out of the lease. Now, of course, you're entitled to all the equipment. You could try to sell that privately, but the average office is you're going to have a hard time selling that office. It's just not going to sell. That's what the problem is. It will not sell, and you're going to run into problems. All right? So, the other thing is the banks are not going to finance the transaction. They're not going to finance it. The cash flow isn't there. You're 30% or higher than 10%. The new buyer is not going to get the finance. It won't cash flow. In other words, it's just not going to work out under those circumstances. So guideline, check your lease. If your lease is higher than 12%, your rent, you gotta think twice about it, what you're going to do. And I would go immediately to a sale price. Speak to your attorney, speak to your accountants, but I think it'd be a record sale. That's what I believe it would be. And most brokers don't want to take that on either. It's just not going to move. So you want to get out and you don't want to linger. And you certainly don't want to renew your lease. Maybe you go on a month-to-month or something, whatever. Get the advice from your attorney, but that's my suggestion. Those are the problems that you'll have. We just got off the phone with the doctor about that. All right, thank you. Nice chat with you. We're leaving for the cruise. So we'll try to do that's the cruise to Japan. We're going to try to do some videos from that. And should be a great cruise. It's going to Vietnam, Hong Kong, Kobe, Taiwan, Singapore, Tokyo. A lot of great stops. And also, Taipei, Taiwan. Follow us, and we'll be doing some videos from there. All right, team. Goodbye now.